Assalamu alaikum, honorable panelist and learner audience. Good afternoon. I am Dr. Mohammad Imran, a specialist cardiac surgery department, here to present outcome of coronary endarterectomy with coronary artery bypass graft 5-year experience. Coronary endarterectomy was first described by Bailey et al. In 1957 as a treatment strategy for coronary artery disease without doing coronary artery bypass graft. Coronary endarterectomy is a challenging procedure for a cardiac surgeon, although in most cases, careful selection of the endarterectomy site, anastomotic site may avoid the need for endarterectomy, but there are still some patients for whom the surgeon needs to do endarterectomy. Essential indications are diffusely diseased coronary artery, diffusely diseased with calcified plaque, disruption of the plaque during coronary anastomosis. Total 812 coronary artery bypass graft performed by senior consultant Dr. Nuruddin Mohammad Jahangir in last 5 years. Among them, 87 patients needed coronary artery bypass graft with endarterectomy. All of them had triple vessel coronary artery disease. Among 87 patients, there were 57 men and 30 women. Age range was between 50 to 72 years. In this study, endarterectomy performed in diffuse coronary artery disease by close traction technique. Target coronary artery was immobilized with mechanical stabilizers. Arteriotomy incision was 8 to 12 mm long. Endarterectomy performed with the help of delicate ring forceps and 1 mm probe by slow and continuous traction of atheromatous plaque. After removal of plaque from selected artery, atheroma was inspected and a smooth distal taperant and retrograde flow of blood from endarterectomized artery indicate proper removal of the plaque. All patients got heparin within 4 hours after surgery and dual antiplatelet therapy within 8 hours after surgery. Warfarin started after chest drain removed and overlapped with heparin for 2 days. Combination of prasugrel and aspirin started after chest drain removed. After discharge from the hospital, patient underwent a checkup at regular interval. This figure illustrated atheroma from the left anterior descending artery. Double endarterectomy performed in the single patients. Figure is showing bifurcating atheroma, proximal part from distal coronary artery and distal part from posterior descending artery and posterior lateral branch. Figure B illustrated atheroma from left anterior descending coronary artery. Now outcome. Among 87 cases, 82 cases required cardiopulmonary bypass, 82 cases performed without cardiopulmonary bypass, and 5 cases required cardiopulmonary bypass. 8 patients required multiple endarterectomy, double endarterectomy done in 5 patients, and triple endarterectomy done in 3 patients. This table shows site and number of endarterectomy with choice of conduit. 49 endarterectomy done in left anterior descending artery, choice of conduit was left internal mammary artery. 14 endarterectomy done in diagonal artery, choice of conduit was gate-saphenous vein. 10 endarterectomy done in obtuse marginal artery, choice of conduit was gate-saphenous vein. 25 endarterectomy done in right coronary artery. For 14 cases, choice of conduit was radial artery, and for 11 cases, choice of conduit was gate-saphenous vein. Early mortality rate was 1 and late mortality rate was 3. Overall mortality in 5 years is 4, which is 4.59%. Dr. Ridiranjan and Professor Dr. Rashid Bonadikari performed 2,189 CBG. Among them, 1,000 patients needed endarterectomy. 1,200 endarterectomies performed in 1,000 patients. Of the 1,200 endarterectomies, 75.1% endarterectomy done in left coronary artery territory, and only 24.9% endarterectomy was done in right coronary artery territory. 16.5% patients required multiple endarterectomy. There were 18% conversion to on pump using cardiopulmonary bypass. Postoperative mortality rate was 1.8%. There were no intraoperative mortalities in this study. Lifestyle et al. Observed long-term benefits following coronary endarterectomy over a period of 14 years include 27,095 patients, of whom 12.4% patients needed coronary endarterectomy, and they observed that 10-year survival rate of this patient group was 68%. In this study, 98 endarterectomy were performed in 87 patients. Of the 98 endarterectomies, 74.49% endarterectomy done in LCA territory and 25.51% done in RCA territory. 9.19% patients required multiple endarterectomies. There were 5.74% conversion to the on-pump CVG using cardiopulmonary bypass. Postoperative survival is 95.40% and overall mortality in 5 years is 4.59%. There were no intraoperative mortalities. With the increasing incidence of diffuse coronary artery disease and improving results of endarterectomy, it is very important for cardiac surgeons to have coronary endarterectomy in their armamentarium to achieve complete myocardial revascularization. Improved surgical technique and better postoperative care can greatly improve overall result of coronary artery bypass graft with endarterectomy. Thank you all.